glad that they're also being called out. The Sports Directs, the Weatherstones, and the financial institutions, and some others, the Amazons, the Ubers. We really have to change this, and hopefully they'll take the lessons very quickly, or they'll be out of business.
You get a sense that some of these changes, these partnerships, these collaborations, the other things that you're talking about, that they might persist beyond this crisis? Do you see at least the green shoots of long-term collaboration, or is this just an emergency bringing unlikely bedfellows together that will then kind of separate when this is done?
Well, that's a good question. And someone was asking me or making a point to me the other day that if you look at any of the crises that we've had or pandemics that we've had in the history of mankind, that is not the only one. It is obviously the most severe one that we are dealing with now, potentially. But we always went back to normal. I actually disagreed with that, but I'm not a student of history, and you probably have a better answer to that. But I think that this crisis is of such magnitude and has shaken our economic system so much that I think a lot of people are going to ask fundamentally different questions. First of all, it's affecting our behavior. And we've created, again, a sense of responsibility, a sense of community, a sense of morality that perhaps was missing, or that was starting to be missed in where we came from. I hope that lots of these efforts around that, the communities that have sprung up, the humanity that has come back as a priority, that stays with us. And I tend to believe it will. We're also now seeing that society is calling out for that behavior. We see the Edelman survey coming in a few days ago, clearly separating, but also rewarding. Johnson & Johnson yesterday was announcing, good for them, that they would make these medicines that they're developing that they think might be available in September, that they would make them available for free. It's not an announcement that normally the shareholders would like to hear, but the share price went up. Mm-hmm. We see also the investor community stepping up around ESG. We see actually ESG investment holding up better than the non-ESG investment. The green bond market actually is doing very well. We also see some of the bigger fossil fuel companies being under more financial pressure now, despite all the other things, than the green energy sector. So I think this might, in some areas, have accelerated changes, and we have it totally in our own hands, I think, to decide what future we want coming out of this.
Great. So you talked about that long sweep of history. I can't say I've studied all of it, but again, looking at World War II and what persisted afterwards, I've studied business schools, and it turns out there were a number of innovations that created the modern business school that really were created in the middle of wartime. Some lasted, some didn't, or took another few decades to come back. So somewhat parochial question, but since a lot of the listeners here are parts of a business school community, the Oxford side community, what's the role of a business school? Challenge us to do what we need to do in this crisis to do a good job. You and I talked about this in January in Davos, and I think the discussion we had is even more important now.
Yeah. Well, obviously, what you have seen in this crisis is trust is very low. But the healthcare community, and credit to them, we all admire them now 10 times more than before. Mm-hmm. They're now the most trusted in society. So are your families. Actually, the trust in business is going up. That's very encouraging. But what always has stayed high is the trust in the academic institutions. Mm-hmm. So a big role is to be played. Many of the universities, you have a community of 40,000 people that are connected to the Saïd Business School alone. The university, obviously, a community that goes well beyond that. Taking an initiative like this, bringing this community together, sharing best practices, being the voice of thinking or direction when we need that confidence, when we need that communication, when we need that calmness to deal with this situation, is a very important role to play. The university is an incubator of innovation. Mm-hmm. You are the leading school with sight of innovative business models. The Colin Myers, the Bob Eccles, and many of the other staff you have, you're very blessed. And one of the reasons I was honored to be the chair of your school. But it's also these people are on the foreground of what a different economic model is needed. A model that is more sustainable, a model that is more equitable, mm-hmm. a model that is more inclusive. a model that is more multi-generational. And I think the seeds are being sown for a fertile ground to drive to that. And the Saïd Business School will have a leading voice in that. And then there are the partnerships. We're starting to work with the Saïd Business School and others on the modeling on what do we need to do. There are many different scenarios on how do we come out of this crisis. It's not so obvious. You know, can we continue like this, or how long, and how much damage would we do to our overall economic systems, and what are some of these recovery paths when we come out of these lockdowns, and how do we need to manage those? I would very much hope that the academic institutions are a part of that. And last but not least, a thing you've already referred to, at the Saïd Business School, we've created enormous partnerships. We know how to work with the private sector, but we also know how to work with the governments. We have the creative incubators that you've developed there. And being this convener of these partnerships is something that I think is very well given to these academic institutions.
Right. Thank you, Paul. I'm going to go to questions in a moment, just to get a sense of people from Senegal, Manchester, South Africa, Romania, India, Cyprus, Canada, Switzerland, Nigeria, Chicago, Kuala Lumpur, Colorado, Chile, Milan, and much more. Sorry, that's a combination of countries and cities, but you get a sense of how broad the listeners are today. So there's a set of questions, Paul, about how this immediate agenda intersects with the longer term agenda. So there's questions about climate and how climate might play into the longer term future that we're going to have, or how the SDGs fit into all that. It seems, well, you kind of hinted at this before. So how do we keep battling this set of, I was saying two, perhaps it's three: a humanitarian crisis, an economic crisis, a public health crisis, but yet not lose the North Star of some of these things that for the next generation or two or more will be critically important. How do we think about immediate term, medium term, and long term?
Yeah, what we have learned on the one side is that as we deal with this enormous humanitarian tragedy and the health crisis that we need to focus on, and potentially a food crisis that is coming around the corner, which is very much on my radar screen right now, we should not forget that we have the climate crisis, or the overall human development crisis as captured in the SDGs. I don't think it's the moment right now to piggyback on the health crisis and make the rallying cry for the climate crisis, as people really want to see solutions to what we have to face right now. I understand that to a certain extent, but it is good to remind us that by not addressing the climate crisis and by not addressing the fundamental parts of the Sustainable Development Goals, the education, the healthcare, our food security system, our planetary boundaries, we've actually created this crisis. This COVID crisis is a direct result of us playing around with the planetary boundaries. It's a direct result of deforestation, wild animals getting closer to human life, unsustainable food supply chains, in this case, the wet markets with the bats, and then contamination of the animal kingdoms with the human kingdom, if you want to. And historically, we've been able to manage that and play that dominance. But I think we're getting a significant warning sign right now that we cannot play with these planetary boundaries. What we have to be mindful of is that, and some of the signs we're seeing that start to worry us, that some governments are using this health crisis to significantly reduce some of the standards on the environment. You see lobbying of car companies to reduce emission standards here in Europe and the US. You see Trump passing some legislation very quickly in some states in the US, now that the attention is somewhere else on environmental standards. We've seen a little bit in China, where people were happy that pollution was back because it meant that the economy was starting to grow again. So short term, I think we might see a little dip, but we have to be very vigilant that the plans we put in place over the longer term actually help us implement the Sustainable Development Agenda. And the Secretary General has started to talk about the recovery plan. He called yesterday for peace everywhere. I think this is a great moment as we address this global crisis, but he's also called for accelerating the implementation of the Sustainable Development Goals. Despite the regrettable but understandable decision to postpone the COP26 in Glasgow. The decision was made yesterday, and it will be early next year. It doesn't mean that we should slow down. In fact, I think we can collectively think about accelerating now some of the actions towards the Sustainable Development Goals. The sad part, Peter, is that the cost of this crisis, where we've put in now $5.2 trillion, but the cost, the human tragedies, are not able to express in any monetary terms. A lot of that could have been avoided had we spent a little bit more and a little bit quicker on starting to implement these sustainable development agendas.
Yeah, agreed. One of the things that we all study at business schools and in business, and you and I have talked about this, Paul, is metrics. So, whether it's in G7 or G20 or ICC, what are the indicators that you're looking at to understand not just the pandemic, but the other aspects of this humanitarian, economic, and public health crisis? So, what should be on our dashboards from society's perspective now?
It depends where you're sitting, Peter, obviously, what the indicators are. For us, one of the most important indicators to see that we are able on the road to recovery and hopefully normality or a better world is the peaking of the number of cases. We see still a doubling every 2.5 days. At the beginning of the week, there were 300,000 cases that were reported. Now there are 1 million. So that's the schedule that we're on. So one of the most important indicators are, in fact, the health indicators in terms of bringing society back to normality. And the second indicator actually is the credit availability. There's a tightness in credit that is not healthy, and that actually is undermining any of the other activities in fiscal and monetary policies. So if we don't see that happening at the macro level, and then actually as the organizations that I represent, we're looking at some other indicators more around actually the matching the words with the deeds. We see more countries putting export barriers in place. We're seeing a food system becoming gridlocked. And so we're more worried about that in the coming 3 to 6 months and holding countries to a higher level of responsibility. And then we are tracking very closely what is happening in the emerging markets. Having said several times that this is a global crisis, we need to be sure that enough energy and funds and actions are taken to protect the most vulnerable of the vulnerable. And I may add one dimension to it, that if you look in Africa, for example, women are disproportionately in the labor force for agriculture. Women are disproportionately, obviously, unpaid home workers. And what we see again in this crisis, like in most of the Sustainable Development Goals, it is the women that suffer most. Interestingly, with the financial market now, the main indicators, I think, have not anymore become the normal indicators. The financial market is actually fairly tolerant towards companies that announce no payment of dividends or that actually announce a drop in their turnover. I think what is the financial market would now appreciate is companies that can be can show that they're actively involved in addressing this issue, and companies that can actually show that they take a holistic approach towards solving this. And that's what we see increasingly also being rewarded by a growing part of the financial market. So that's an indicator of the corporate health, if you want to.
Okay. There's a number of questions that are about specific industries, specific regions. But let me use Ani's for a moment. How will the population clusters look in the future? Urban, semi-urban, rural? And will that clustering undergo change, either forced or by choice? So rather than think about countries or industries for a moment, let's think about structures of society. Do you see that this might lead us to be less urban, more rural, whatever? So how do you see kind of macro? And obviously, none of our crystal balls are that clear. None of us have crystal balls. But what are your thoughts about how this could change fundamental demographics?
Well, in terms of rural and urbanization, if I may start there, I think it is difficult for me to see a significant change in the current trends. As you well know, we've just passed about the 50% urbanization level globally. versus rural. We're slightly higher now there. And we are heading over the next 20 years, 25 years to about a 70% urbanization. I think our economic systems and our interdependence will drive us there. And the key question there is, as our population grows to about 9 to 10 billion, as our urbanization grows from 50 to 70%, we actually have to build the same number of cities in this world over the next 20, 25 years as what we currently have. So how we build that infrastructure is a very important part of the Sustainable Development Goals. We're going to spend $16 trillion over the next 15 years on infrastructure. And spending that in a responsible way, a climate responsible way, an SDG compatible way is going to be very important, because this virus has also brought to life, if we live in these communities, how we need to protect ourselves in these communities. So the design of these cities might be different, the way we think about that in terms of achieving these Sustainable Development Goals. But the fact that urbanization will go to 70%, that we have the bulk of our population living in 700 cities in the world, these mega cities, I don't think that trend will change. It's very difficult, because a lot of that is already an infrastructure that is in place that we're building on. In terms of demographics itself, it is good to remind ourselves that about every year, 8 million people die from tobacco. And every year, as a coincidence, 7 to 8 million people also die from air pollution. So this virus, we have now seen, regrettably, the 50,000 deaths. Some people are estimating that that number might go to 1 million. We all hope not, but let's assume it is 1 million. It is still significantly less than many other causes. I actually personally think that more people will die now of domestic violence or loneliness, or actually not getting the right medical care because all these hospitals have been converted, than actually the coronavirus. What drives this more is our fear, our inability to deal with this, and the speed that this is coming to us, than anything else. So is this a major shift in demographics in terms of age profile or other? I don't think so either, Peter. I think that's very unlikely. There are many other factors playing a role that we should pay more attention to.
Let's talk about inequality for a moment. There's two levels of inequality. Normally we think about it, and I'm going to ask you how you think this is going to play out with respect to the kind of income and wealth inequality that I know that you and I care so deeply about and our community cares about. But there's a question, a pretty subtle question, which speaks to a different kind of inequality. So maybe you can address both of them. This other question says, there are rich countries and poor countries. The rich countries will bail out or support their industries. The poor countries won't be able to. So in addition to the kind of inequality at a personal level, we might start to see even greater inequality at a national level, at least in corporate sectors. There'll be winners and losers because the US can bail out, the UK perhaps can bail out, but other countries won't be able to. So if you could address those two levels of inequality, kind of the personal level and then this industrial level.
So I think this crisis, again, has shown more the gaps that exist in society. When everything was sort of moving in the right direction, although I would have argued to that our economic system, even before the crisis, had too many people that were not participating or were falling behind. Income gaps were going up. The bottom 3.8 billion people in the world actually in 2018 saw their combined wealth go down by 11%. So we already knew we had a job cut out for ourselves. Now it's very clear that has been exposed even more so, and it's even more fragile. And it's even more fragile, to some people's surprise, regrettably, in the developed world first and foremost. The state of California has 60,000 homeless people. Besides the risk of having being able to contract the COVID-19 virus, that number is more likely going to double in the weeks as we sit here, and it's happening. 1 in 4 lacks sick pay, 60% lack medical leave for longer-term illnesses. We reckon there's 37 million people that might potentially be unemployed in the United States. Many of them obviously are living from daily wages and are in what we then call this wonderful gig economy. So I think it has shown the underbelly of society, a little bit less in Europe perhaps right now, because the social networks are a little bit stronger. But this is a significant human tragedy that is only unfolding yet or starting to unfold under our eyes. The emerging markets have been less susceptible to that because obviously many more people already found themselves in that situation. But you take now Bangladesh, about $2.5 billion of garment orders were canceled last week. And all these people, it's now by the hundred thousands are being sent home. You see them in India with the lockdown, where people had to walk home for hundreds of kilometers to go to their villages, but there's no income and no salary. So if we don't keep the food supply going, which is our immediate concern, food, by the way, depends a lot of foreign labor coming in, temporary labor. And these people are actually already at the bottom of many of these economic pyramids. So if we disrupt those processes to grow our food supply, then we exaggerate the issue that we're now creating. I think coming out of this, we hopefully have discovered that we are first and foremost citizens of planet Earth and need to work together. So better global cooperation, although that might not be very evident if we listen to some of the politicians. But I do hope that we can force ourselves to a level of higher global cooperation again. And that's very much where the International Chambers of Commerce is focused on. And hopefully have new social contracts coming out of this that provide better safety nets for the people that don't have it now. We see the enormous cost by not having it provided. And hopefully part of the recovery plans will take care of that. The difference between the developed and the developing markets, will that change much as a result of this crisis? I don't think so either. I think it is a little bit appalling, may I say, how slow the developed market is willing to support organizations like the IMF to issue special drawing rights, that we are still not willing to cancel debt in the emerging markets. Even in Europe, you have, unfortunately, my country, the Netherlands and Germany, holding Europe hostage with Corona bonds, which really are a mechanism right now to step in and create some flexibility for the Southern European countries who happen to have the bulk of the issues now to deal with. But again, so it has shown a little bit the lack of solidarity in our global system. And again, that's another area we're pushing. But I think when we get out of this crisis, I'm not so sure that that balance will be significantly restored. For now, that focus is there perhaps a little bit more than we had before because of the interdependence of the crisis. But once that crisis has been brought under control, like we saw with Ebola, or like we saw with other food crises in Africa, other things, we tend to forget fairly quickly.
Thanks. There's a number of industries that people are asking about and probably representing the wide diversity of their backgrounds. And people are asking about oil and gas. People are asking about online. People are asking about retailing. But one that's coming up over and over again is the healthcare system. What's your sense of when we emerge from this, what lessons we're going to learn about the healthcare system that you're hearing discussed in the G7 and the G20 and the ICC? Now, obviously, for the moment, it's about taking care of healthcare workers, making sure they have enough ventilators, respirators, protective equipment. But beyond that, do you see longer-term changes in healthcare systems? Understanding that the NHS, which is everyone here is rallying behind, is different from the U.S. healthcare system. The national healthcare systems are different, but are there any general things that we'll think about in terms of healthcare systems or public health systems that there'll be lessons that we're going to learn from this?
We need to, and the script has to be written, and I don't want to pretend to be an expert on the healthcare to answer this completely, but it is very clear that our healthcare systems are broken and stretched to the tilt. And it's from different areas, the availability of the medical profession itself and the support. Organizations like the NHS have been hollowed out. The US has a healthcare system that is only accessible to the upper parts of society and not the lower parts of society. Many parts of the emerging markets have very fragile healthcare systems. So I think there is a major relook that undoubtedly will take place in terms of how we provide healthcare and hopefully go to a more decent level of universal healthcare coming out of this. The second thing we have to look at is the supply of healthcare. It's very concentrated, and it's also coming only from a few countries. Few countries providing certain drugs, few countries providing ventilators, etc. And whilst we have started to think a little bit about water and water rights and accessibility of food systems, that we don't get exposed on our medical systems, we have a very fragile supply chain that is also very clear right now. So I think in terms of the supply chain, the providers, the flexibility that we need will certainly be another change. And then at the global level, I think we'll be seeing changes as well. The response to this, the common response was relatively slow. Even the WHO and Taiwan already reported the cases. And when news was trickling out of China, for different reasons, we didn't call it a global emergency yet immediately. And that has given us a slower response. And then when the response came, it wasn't very well coordinated at global level. So I think our global coordination will also change. So a change at local level in how we provide healthcare, how our infrastructure around our healthcare is being set up, and then how we globally start to coordinate what will undoubtedly be increases of these occurrences needs to be looked at. And some people are starting to work this already. The benefit that we have is increasing access to IT. Soon we can do self-diagnosis on the telephones. There are some apps coming up now that are quite promising, actually. But at the same time, we also then need to think about civil liberty and human rights. There are aspects that the academic institutions and sites, etc., can play a key role in, because when we design these solutions, we also need to design that again with ensuring that we keep citizens' power and that we don't move to more dictatorial governments. Think about a telephone that can measure your temperature or that can analyze your emotions, and think about speeches of heads of state and then matching if your emotions align with the intent of the speeches, and if they don't, you're out of a political system. That's not a society I want to go in, or where everything is face recognition and you're getting points, and these points allow you to go to the Saïd Business School or not, is not something that we want to advocate. So thinking about the medical side has a big component of ethics that also need to be discussed in this.
And on that, I'm proud to say that a number of the ventures that we're working with in the Foundry and other places are working on exactly the technologies you're talking about, at least the health technologies, telemedicine, remote support for doctors and all that. We have a number of...
Your creative disruption thinking there is also probably appropriate. You're a leader in that.
Well, and I'm maybe jumping the gun because I don't know if the public press release has gone out, but we will be launching in conjunction with 7 or 8 universities across the world, Creative Destruction Lab Recovery, which is a combination of 2 streams of both a set of businesses that are working specifically on the pandemic and health-related issues, and then another set of businesses that are working on recovery. But we have a number of guests today who are part of this session who are at the Skoll World Forum. And at the forum, we have often social entrepreneurs, impact investors, and philanthropists. What do you see as the role of philanthropy, not just immediately, where we're seeing that they're playing an immediate role in terms of relief and also emergency funding, but what role do you see philanthropy in that sector, let's call it the nonprofit sector, the social enterprise sector, and philanthropy, playing in recovery and resilience?
No, increasingly so. Were it not for some of the bigger philanthropists, and the Bill and Melinda Gates Foundation is often obviously heralded, but you look also at major contributions that are made to a global fund or to Gavi, where governments and philanthropists go together. Often they are catalyzers of change. Lots of these philanthropists were business people nowadays. It's increasingly concentrated towards very high net worth individuals, and they run it also with a certain speed and focus and business intensity that I have to personally say I relate to, especially when I see some of these governance functioning now, or rather say not functioning. So I'm glad that they are there. Often they fill the cracks. Often they bring in the first funds, the speed, they provide the speed and focus. So they're a big part of that. If that is done with a license to operate, and if that is done with taking a societal responsibility and not a self-interest. I'm on the board of the Rockefeller Foundation. I run several foundations myself that we have, and I can see what functions we fulfill. Now, more importantly, your question of coming out of this recovery, I think that their role is going to be even more important. And I was talking the day before yesterday with people like Oxfam, like Sense International, my own charity. They are under incredible pressure. The high street stores are closed, which is a big source of their revenue. The London Marathon is cancelled, which is a big fundraiser. Other fundraising things are cancelled. If we think that companies are under pressure, which they are, the philanthropic sector is even under more pressure because the money simply isn't coming in anymore. And it is a shame if we would lose out on too many of them. Some shakeout and some reorganization is always good. But if we lose too many, it's a problem, because those are exactly the organizations that are on the ground, that deal with the disadvantaged, with the socially more exposed. And when it gets to recovery, we can have the big plans where we are sitting, Peter, and make the global statements and align and have big numbers that we put forward. But ultimately, what happens in the local communities is what counts. And that is often done by the humanitarian sector. So we need to be sure that we keep them strong even during this crisis, that we don't renege on commitments, that we as individuals have capabilities to financially support them. We should actually ensure that we give that priority so that they can come out stronger and play an incredible part in this recovery where we certainly will need their help.
Great. So Paul, last question, short answer. What have we learned about leadership?
Well, that's a good question. I think the learning is still going on, and that is one of the areas that I think you will be key in guiding us and the institutions. But I think, first of all, we're seeing that there is a different form of cooperation. So I think a cooperative capitalism form might be there. There's a higher moral level that is being called for. So that's the moral capitalism part. I think we have become a little bit more human and a lot of self-reflection. So that's a human form of capitalism. So I see that you see a new stakeholder capitalism emerging. I think this is definitely a defining moment. I've always felt it before the crisis, but this is helping in the sense that we're moving from shareholder primacy to stakeholder primacy. And what we need is now leaders that are more purpose-driven, that can work in these partnerships, that are multi-generational, can handle this complexity, the systemic thinkers, and then get into clear, focused action for the future. And above all, leaders that are operating with a high sense of morality, authentic, real. These are the people that I think will have a bright future. And these are the people that we will follow as the leaders of today already and of tomorrow. And these are exactly the leaders that the Saïd Business School is producing. That's why I'm proud of having this incredible student body being able to listen in and be part of this movement.
Thank you, Paul. That's what we're trying to do. We try harder every day. And I guess this is a great way to end, because it's about systems thinking and understanding how all the parts of the world fit together. But it's also about understanding how to take action in organizations, but at a very human level. It's about our values, our ability to be kind to one another, the ability to understand that behind stakeholders are human beings, whether those human beings are our employees or their customers, or even the people who hold our shares and our pensioners, or the folks who are suppliers. So I think what this is bringing into stark relief, that I think is coming from what I hear from you, Paul, is an understanding of these big complex systems that are all intertwined, but the human beings that are very much behind all that. And so thank you, Paul, for your leadership in the world.
Thank you.
Thank you for joining us today, and thank everybody for joining us today. That's about all the time we're going to have for this live stream. We're going to post highlights on this session on Oxford Saïd's website and our social channels at Oxford Saïd Business School. If we were kind of together, I would ask you to clap, join me in thanking Paul. I'll do it myself. The sound of two hands clapping. I'd like to invite you all back on the 7th of April, on Tuesday, for a session on personal and professional well-being and mental health during the COVID-19 crisis. Clearly, one of the first things we have to do is to take care of the people, and we can only do that if we're worried about personal and professional well-being. And then on the 9th, we're going to come back with COVID-19 preparedness, resilience, and the future of public health. Both of these sessions are with a combination of our faculty at Saïd Business School. We will also be doing leading from the front sessions like this one with Paul, where we're talking to people who are kind of at the front lines, as Paul is, at the G7, the G20, the ICC, the World Economic Forum, and more. I'd like to thank everybody who has contributed and watched us today, from all of us here at Saïd Business School in Oxford, from Paul Polman in Geneva. For those of you who are watching the Skoll Forum, wherever you happen to be, I want to wish you that you be safe and healthy, and that you come and join us again next week. For those of you who have a little bit more time this afternoon, at 4 p.m. British summertime, is the Skoll Awards for Social Entrepreneurship. And we will kind of celebrate those amazing social entrepreneurs who are trying to make a difference. And I think these days, we're all social entrepreneurs in some sense, because all of us are called to make a difference. Thank you so much. And as I said, be safe and be healthy. Thank you. And thank you, Paul.
Thank you, Peter. Thank you.